Assalamu alaikum. So today we will start with follicular conjunctivitis. Now last time around we discussed bacterial conjunctivitis. We did three groups of cases in bacterial conjunctivitis. We discussed our typical bacterial conjunctivitis. We discussed the bacterial conjunctivitis in which we can see follicles. And then we discussed ophthalmia and unitarum and its differentials according to the time period at which the symptoms present. So before we start with follicular conjunctivitis, I'd like to go through the MCQs. थोड़ी सी MCQs से कुछ important points थे जो हमने discuss किया था, कुछ वैसे MCQs थे. So let's go over them one by one. Grading of trachoma includes all except it's relatively easy. The Fister classification. You have to remember the Fister classification. Those 5 words they encapsulate more or less all of the symptoms except a few. So TP, Pinus is not a part of the grading of trachoma Fister classification. So this is the right answer. Pathognomic features of follicles in trachoma. And this थोड़ा सा tricky सवाल था because I forgot to discuss this in the lecture as well. There is no other follicular conjunctivitis in which bulbar follicles appear. हमने जो differentiation की थी between viral conjunctivitis, inclusion conjunctivitis, and trachoma conjunctivitis. It was this that in trachoma conjunctivitis, follicles are more in the upper palpebral conjunctiva compared to the lower palpebral conjunctiva. Meaning that in both the cases, in all cases, follicles can appear in both the conjunctiva. Okay? But in this MCQ, there is no as such description mentioned. मैंने कहीं लिखा हुआ कि palpebral follicles more in the upper conjunctiva, right? Now, bulbar follicles, they are pathognomic or present only in trachoma. You have to remember this. So the correct answer in this case is bulbar follicles or limbal follicles. Swimming pool conjunctivitis, it's another name for acute inclusion conjunctivitis caused by chlamydia trachomatis. Swimming pool conjunctivitis is a buzzword. You have to remember it. Diplobacillary conjunctivitis. एक disease के 3-4 नाम है. It's kind of redundant, but examiners they like to go towards it. पेपर में भी ऐसे को बुक्स में डिफरेंट लिखा हुआ है, जोगी में फर्क है, जितोई में फर्क लिखा हुआ है. So diplobacillary conjunctivitis, angular conjunctivitis is called by diplobacilli, also called Morex Axenfeld bacilli, also called Moraxella lacunata. तो ये 3-4 नाम है एक चीज के. You have to remember these names क्योंकि कभी-कभी होता है कि you know the answer, you know everything, the signs and the symptoms and the treatment as well, but you get confused because of the different names. So Morex Axenfeld bacilli. Correct statement regarding time of onset in neonatal conjunctivitis. Now all of these are correct. Within 48 hours, gonococcal ophthalmia, 2 to 3 days, non-gonococcal infection, 5 to 7 days, HSV infection. Over 1 week, chlamydial infection. All of these are correct. Bacteria responsible for causing keratitis, conjunctivitis, and blepharitis. Now, the important giveaway over here is blepharitis. Okay, conjunctivitis and keratitis can occur in a lot of conditions. We will discuss them when we get to cornea. It can be caused by herpes simplex. It can be caused by virtually any conjunctivitis which is left alone to invade the cornea. But blepharitis as well. And these two symptoms. Now, the most common pathogen, Staph aureus, it's the most common culprit. Okay, यही कराता है सबसे ज़्यादा. So Staph aureus is the right answer. In addition to pseudomembranous conjunctivitis, true membranous conjunctivitis is caused by. थोड़ा सा tricky है ये भी. Pseudomembranous conjunctivitis, we know that pseudomembrane is a membrane which can be easily peeled off, and upon peeling off, there is no bleeding on the surface, right? True membranous conjunctivitis is opposite to this. It cannot be easily peeled off, and when we peel off a true membrane, there is residual bleeding. So when we discuss pseudomembranous conjunctivitis, we have two organisms only. One is Corynebacterium diphtheria, and there is strep pneumonia, strep cocci, Staphylococcus pneumoniae. So the correct answer in this case is Corynebacterium diphtheria. Corynebacterium diphtheria is famous for pseudomembranes and true membranes as well. You have to remember this. Pseudomembrane का मतलब ये है कि there is so much exudate, so much pus that it accumulates over the surface and it forms a pseudomembrane. And true membrane में there is pathogenic invasion, and the raw surfaces, the raw mucosal surface, it gets adherent to the membrane above. So true membrane and pseudomembrane formation occur in Corynebacterium diphtheria. Effective agent for treatment of angular conjunctivitis. We discussed three different agents, three important agents: oxytetracycline, zinc sulfate, and zinc oxide. So whenever a treatment shows zinc, angular conjunctivitis, and you have to remember the treatment is zinc. The feature absent in trachoma. Again, this is a very tricky one because I did not discuss papilla and hornet ranta spots. So follicles in Art's line, they are present in trachoma. Not as confusing. What are hornet ranta spots? Hornet ranta spots are lesions, characteristic lesions which are present in allergic conjunctivitis called vernal keratoconjunctivitis. We'll discuss them in our next session. Now papilla. I've been telling you, मैं बताता जा रहा हूँ काफी दिनों से और ये sessions में कि papilla are present in allergic conjunctivitis and all that. That is generally true. And from the examination point of view, ऐसे ही होगा. You will not be discussed papilla in other scenarios other than allergic conjunctivitis. But papilla are present in trachoma. You have to remember this. Papilla, the finger-like projections, the vascularized bodies or nodules, they are present in trachoma, but they are sometimes marked or covered up by the follicles. The important thing is that they are present in trachoma, but they will be unlikely, it is unlikely that they will be given to you as symptoms or features of trachoma. They will most likely be given to you in the context of an allergic conjunctivitis. So the answer is papilla. All right, next MCQ. Now this is acute gonococcal conjunctivitis. It's relatively simple. There's an absence of follicles without follicle formation, and then history of an STI, and a 2-day history of an STI. So history of an STI and conjunctivitis in a sexually active male, we have to consider our two possibilities, gonococcus and chlamydia. There isn't follicle formation, and the incubation period is kind of small, so it's unlikely it's chlamydial conjunctivitis. Gonococcal neonatal conjunctivitis. Now, you have to remember that in 50% of the cases, gonococcal conjunctivitis and chlamydial conjunctivitis, there is a co-infection. यानी कि दोनों मौजूद होते हैं. Even if the symptoms they start early or even if the symptoms they start late, you have to remember that in these cases of vertical transmission of ophthalmia and nidarium, both can be present, and that is why you have to treat both. Specific treatment of gonococcal conjunctivitis is IM ceftriaxone. That is correct. But when you manage a case, you will give the patient both ceftriaxone and oral azithromycin. On histological examination, which finding differentiates trachoma from other follicular conjunctivitis? Now, this is also a tricky one because I haven't discussed Leber cells and this characteristic finding. But if you look at all the other options, it's not difficult to come to this right answer. So we know that follicular conjunctivitis can either be viral, it can be acute inclusion conjunctivitis, and it can be trachomatis. Now, a dense eosinophilic and mast cell infiltrate, this is found in allergic conjunctivitis. So we can rule this option out effective immediately. Gram-positive bacilli along cellular margins. So viral conjunctivitis, acute inclusion, and chlamydia trachomatis causing trachoma. दो ही organisms हमारे पास हैं, chlamydia or viruses. Viruses aren't gram-stained, so this option is unlikely. And chlamydia isn't gram-stained as well. And if it is gram-stained, it is gram-negative. It's intracellular, that is why it's unlikely that chlamydia is gram-stained. So this option is ruled out as well. Third option, catalase and coagulase positive organism. This is Staph aureus, most likely. Viruses do not contain enzymes, and chlamydia contains neither catalase nor polymerase. So by effectively ruling out all the other options, you come towards Lieber cells and bands of scoring. And this is the characteristic histological finding of trachoma. So these were a few MCQs based on the points which I was not able to discuss last time. So coming towards today's topic, I asked you guys three things. मैंने आपसे कहा था कि आपने पढ़ के लानी है. They were Artstein, Pits, and Panis. So we will discuss them at the end of this. These are the findings of trachoma. हम उनको discuss कर लेते हैं. Today our topic is viral conjunctivitis. Viral conjunctivitis, you know the features of viral conjunctivitis and how we differentiate viral conjunctivitis. But I would like to again draw that whole flow chart of follicular conjunctivitis which we did last time. So whenever we have a case stem or a clinical vignette in which the patient presents with a follicular conjunctivitis, what are the important things that we'll see, or what is the first important thing that we'll see in the question stem, which will further our diagnosis? क्या देखेंगे हम सबसे पहले?
Discharge.
Discharge. We will see what kind of discharge there is. So it can either be a mucoid discharge, or it can either be a purulent discharge. Purulent or mucopurulent, दोनों एक ही. Mucopurulent / purulent discharge. What does this tell us? आपने बताते जाना साथ साथ. हमें से क्या पता चल रहा है? Based on the type of discharge. Based on the type of discharge, we can classify our follicular conjunctivitis. क्योंकि follicular conjunctivitis we've discussed, it's infective conjunctivitis मानता हूँ. So a mucoid discharge will point us towards a viral etiology. Viral etiology, right? Mucoid discharge will point us towards a viral etiology. A mucopurulent discharge, it will point us towards a bacterial etiology. Bacterial etiology के अलावा कोई और etiology हो सकती है in which there can be a mucopurulent or a purulent discharge. Another infective etiology. Yes. ये तक डिस्कस नहीं की हमने. It's not that important clinically. आपको जो क्वेश्चन स्टेम में आएगा उसमें नहीं आएगा. It's good for information. Granulomatous. Granulomatous में क्या हमारे पास दो चीजें आ जाती हैं. Either it's tuberculous, either it's fungal. We don't need to go into the details of it that much. So, based on the follicular conjunctivitis, the discharge is mucoid. Our etiology is viral. If it's mucopurulent, we will go towards bacteria. Granulomatous में they will be granulomas present. Question stem it will be plainly obvious. If TB होगा तो patient को TB होगा and all that stuff. So it's not that highly like what to put. Bacterial conjunctivitis. Now, depending upon the location of the follicles, we can have follicles at three places. We can have follicles at the tarsal conjunctiva, the palpebral conjunctiva, upper palpebral. We can have follicles at the lower palpebral conjunctiva. We can have follicles at the bulbar conjunctiva. Now you have to remember that when I say upper palpebral and lower palpebral conjunctiva, it does not mean that they are present only at these places. It means that the quantity is greater at upper palpebral conjunctiva or lower palpebral conjunctiva. So if the follicles they are present in a more amount at the upper palpebral conjunctiva, our diagnosis will go towards which specifically?
Trachoma.
Trachoma. Yes, that is correct. We will go towards trachoma because it is characteristic of trachoma to have more follicles in the upper palpebral conjunctiva. If we have bulbar follicles, our diagnosis will go towards
Trachoma.
trachoma. And if we have follicles in the lower palpebrum in a greater amount, our diagnosis will be
Inclusion conjunctivitis.
acute inclusion conjunctivitis. So this is how you will follicular conjunctivitis आता है तो इसमें आपने इसको देख लेना. Now moving on towards our viral conjunctivitis. You know that in viral conjunctivitis, our main features are on the symptoms. Our main symptoms are redness, pain, symptoms of inflammation including congestion, swelling, hyperemia. If there is discharge, it will be mucoid because that is characteristic of viral etiologies. And on examination, we will have the characteristic follicles, which will be present in a greater amount in the lower tarsal or the lower palpebral conjunctiva. Is one important feature of viral conjunctivitis. One other important feature, which I want you to tell me at the end of this few cases. इसमें कुछ नहीं है, इट्स रिलेटिवली हाई यील्ड, लेकिन इसमें एमसीक्यूज आ जाते हैं, कभी कभी एसक्यू. So it's important that we get rid of this. Our first case. If I read up this case, then we will discuss this case. Because all of the things necessary for the diagnosis are present in this case. What are the symptoms in this case?
Pain.
We have pain. We have swelling of both the eyes, right? Pain and swelling. Now, pain and swelling of both the eyes, iski basis pe we have a list of differentials. We can have a pain and swelling. With pain and swelling, we can have blepharitis. With pain and swelling of the eyes, we can have conjunctivitis. We can have passive edema. We can have orbital cellulitis. So all of these things, and conjunctivitis as well. So these 4 to 5 things should come into your mind when looking at pain and swelling. But our diagnosis is narrowed when we look at the examination. The signs on examination are conjunctival congestion, minimal discharge, and follicles. ठीक है. और अब इसमें हमारे पास स्टेटमेंट में इस मिनट में क्या जरूरी बात है? What else is important?
Enlarged lymph nodes.
Enlarged preauricular lymph nodes. Another important thing in this case.
Contagious.
या मैं क्या बोला, दोबारा बोलेगा?
Many people are infected.
Many people are infected in his office, right? Many people in his office have been affected by the same condition. Many people in his office are affected by the same condition. Now, symptoms and the signs. We know that this is a conjunctival lesion. There is conjunctival congestion. There is minimal discharge, and there is a presence of follicles. So if we apply that whole flowchart above, in the presence of pain, minimal swelling, conjunctival congestion, and follicles. What do you think is the etiology? अब यहाँ तक सिर्फ on examination तक हमें जो पता लगा. What do you think is the etiology of this conjunctivitis?
Viral.
It's a viral conjunctivitis. ठीक है? Follicles and minimal discharge. And discharge specifically we cannot comment, But if we were to comment on the discharge, it would be mucoid, minimal or mucoid discharge. Now, general examination reveals enlarged preauricular lymph nodes, which means CK preauricular lymph nodes involved. He reveals that many people in his office have been affected by the same condition. This is very important, and you will find this statement in a lot of similar conditions, that many people have been affected by the same disease. Now, this placement it stand alone, इसके हमें और कोई इन्वेस्टिगेशन की जरूरत नहीं पड़ती और कोई हमें कुछ कराने की जरूरत नहीं पड़ती. We can form our diagnosis based on this paragraph, and our diagnosis will be of कौन सा conjunctivitis होगा, viral में. These are the different subtypes of viral conjunctivitis.
Adenovirus.
Adenovirus. ठीक है. Whenever you think of viral conjunctivitis, you should always include in your differentials. This is adenoviral conjunctivitis. Adenoviral conjunctivitis, adenovirus conjunctivitis causes scara. But know that there's a habit that the pathogen is different and the name of the disease is different. Chlamydia cause कहता है, chlamydia can cause trachoma, chlamydia can cause acute, including conjunctivitis. Right? Both of the things they cause by chlamydia, although different serotypes. Similarly, adenovirus serotypes cause this kind of virus. Pathogen is adenovirus, but the disease is called epidemic keratoconjunctivitis. This is epidemic keratoconjunctivitis. Adenoviral conjunctivitis. I think this is the case. Now, the important thing in all viral conjunctivitis, you will notice that in all viral conjunctivitis, there are two peculiar things. Number one is enlarged preauricular glands, and the second is that many people in his office have been affected by the same condition. These two things are very important when you're performing a diagnosis, right? Enlarged preauricular lymph nodes, they can be present in a few bacterial diseases as well. But in the presence of the disease spreading to many other people in the same office, our diagnosis is narrowed to a viral conjunctivitis, namely epidemic keratoconjunctivitis caused by adenovirus. This is our diagnosis. Moving on to the second case. स्क्रीन नजर आ रही है? Are the important signs and symptoms in this case?
Pain and swelling of eyes along with fever and sore throat.
Pain and swelling of his eyes. So the important symptoms in this case are pain and swelling of his eyes. He has been running a fever, an additional symptom, and has complaints of a sore throat. So on examination, the important things are mild congestion, no discharge, few follicles. Another important thing, his preauricular glands are enlarged. Preauricular lymph nodes or preauricular glands contain the conjunctiva and they are enlarged. Now, what is different from our first case? In both the cases, we can see that we have pain and swelling of the eyes. Of both these cases, we have conjunctival congestion. In both these cases, we have minimal discharge, no discharge, minimal discharge, and we have follicles. So based on the initial symptoms and initial evaluation of the signs we can tell that both these are viral conjunctivitis. ठीक है, हमें पता लग गया कि viral conjunctivitis है. Enlarged pleural lymph nodes, it's as in this case. The important different thing in the first and the second case, the important thing which is different is that the second case has a complaint of sore throat. So complaint of sore throat, and his mother reports that he had received all immunizations under EPI. So on the basis of these signs, what will be our diagnosis?
Pharyngoconjunctival fever.
Pharyngoconjunctival fever. Pharyngoconjunctival fever. Pharyngoconjunctival fever is also caused by
Adenovirus.
pathogen. It's also caused by adenovirus. You can see how just addition of one little statement can differentiate our कैसे केस बदल गया सिर्फ एक लाइन के साथ. That our patient has sore throat. This sore throat. Why we have diagnosed this patient as and the pathogen is again adenovirus. Now moving on to this next case. If you have read this case, if you read this, you will find that it is not different from the above case except for one statement, which is the last statement. Bilkul same, ditto copy. 15-year-old, pain and swelling, both his eyes, running a fever, complaint of sore throat. On examination, there is a mild congestion or discharge. Few follicles, same. Auricular glands are enlarged, the same as above. One important thing is different. Further history reveals that they are farmers and some of their cows are diseased. इसी आखिरी लाइन के ऊपर डायग्नोसिस हमारा बनता है, and that diagnosis is Newcastle conjunctivitis. Diagnosis is only on the basis of this last line. Okay? It's not different from pharyngoconjunctival fever. Our only important or peculiar thing is that the patient has a history of contact with diseased birds, diseased fowls, diseased chickens, mutnia, turkeys, all of that stuff. This is important, which has led towards our diagnosis of Newcastle conjunctivitis. Moving on. Next. What are the important symptoms in this case? We have a young woman who presents with sudden onset pain and swelling of her eyes and photophobia. What are our signs? On examination, there is severe redness, first important sign. Swelling, second important sign. Marked subconjunctival hemorrhage, which is our third important sign in the eye. And the fourth thing, our general examination yields enlarged auricular glands. Now, an infectious disease has broken out in the group. This is very important. Infectious disease breaking out in the community, it means that there is a
Virus infection.
There's a pandemic or an epidemic, and this gives a clue towards a viral infection. It's a symptom of a corneal lesion as well in this case, in this unit.
Photophobia.
Photophobia. Okay, photophobia is a symptom of a corneal infection. When we look at the symptoms, we have sudden onset pain, swelling of your eyes, and photophobia. Phobia is a corneal symptom. Again, now, severe redness, swelling, marked subconjunctival hemorrhage. Marked subconjunctival hemorrhage in the presence of a pandemic, a viral pandemic or an epidemic conjunctivitis. Broken out disease, when a disease breaks out in the community, it's either an epidemic or a pandemic, right? So a marked subconjunctival hemorrhage in a viral conjunctivitis, which is epidemic in the community. This statement is very important. And on the basis of this statement, again, our diagnosis will be it can be adenoviral conjunctivitis. Okay. Is another term specifically. Is another virus specifically. Adenovirus does cause conjunctivitis, but the hemorrhagic conjunctivitis in adenovirus, it is associated with माइक्रोबायोलॉजी में आपने पढ़ा रहा चलो हम this is acute hemorrhagic conjunctivitis. It is caused by Coxsackie virus. So this is Coxsackie virus. Coxsackie virus. Coxsackie virus A या B? ये आप लोग को बताएंगे. I think it's Coxsackie et al. Is another disease वो भी हम discuss कर रहे हैं. Moving on to our last case for today. आप सबको आना चाहिए. The important points in history are the age, 6-day-old neonate presenting to you with a 1-day history, redness. On examination, there is scanty mucoid discharge. What does this patient have?
Herpetic.
Herpetic. Herpetic what?
Conjunctivitis.
The exact term is ophthalmia neonatorum or neonatal conjunctivitis. Right. That is the correct diagnosis. This patient has herpetic neonatal conjunctivitis or herpetic ophthalmia neonatorum based on the 6-day history and 5-day history of the disease. Basically, it's a 6-day-old neonate. जिसकी उम्र 6 साल है and 1-day history of redness, meaning that the history started on the 5th day of his life. So we know that a disease which starts on the 5th day and has scant mucoid discharge, meaning that there's a viral etiology, and a viral etiology which starts on the 5th day, it is herpes simplex virus, or herpetic neonatal conjunctivitis. Now, if I were to say that this patient had a mucopurulent discharge, what would your diagnosis be then?
Chlamydial.
Chlamydial conjunctivitis, right? So your diagnosis would have been chlamydial conjunctivitis. That is why you have to remember the time periods. Time periods की basis पे आपका पूरा diagnosis गलत हो सकता है, सही हो सकता है. हमारे system में जब prof examination आएगा, the only important thing, except from the type of discharge, will be the time period. These were a few diseases caused by viruses, namely Newcastle conjunctivitis, acute hemorrhagic conjunctivitis, we have pharyngoconjunctival fever, and we have epidemic keratoconus. I will end the session now. Agli session we will discuss these again one by one and the important symptoms and the features by according to which we have labeled them as such. All right. So I'll be back in 5 minutes.